Okay, that worked out good.
Nice. Well, welcome everybody. My name is Marty Mascari. I'm with the North Central Texas Area Agency on Aging and the North Central Texas Aging and Disability Resource Center, ADRC. The ADRC is actually a project of the Area Agency on Aging. I have some contractual obligations to each of the entities. But so today we're going to talk about long-term care Medicare. No, we're not. We're going to talk about, well, this is the last slide. We got to go to the first slide.
Let's go to the first slide.
Sorry, we got to go to the first slide. I'm sorry. We're going to talk about advanced directives and fake government imposters. Next month, we're going to talk about, we're going to talk about advanced directives and fake government imposters. And thank goodness we have Melinda and Diane here to talk about those. But before we do that, I'm going to talk just about the CEUs. And I'll try to do this faster. Basically, we're providing CEUs for licensed social workers, licensed professional counselors in Texas. If you're licensed in another state, you're more than welcome to get a certificate. We have no idea whether they'll work or not, but that's depending on your jurisdiction. You're also invited to, if you'd like to get a certificate of attendance, you're more than welcome to do that. You're going to go through the same process for the certificate of attendance as you do for the CEUs. There's 1.5 CEUs or classroom hours. You must participate in the entire webinar. We document that in 2 different ways. Number 1, we get a report from Zoom that tells us how many minutes you're on. And then we also have you certify that now in this Google survey that you'll fill out at the end of the presentation. The Google survey should pop up as you close out. You must fill that out if you want CEUs or certificate of attendance. You've got to fill out the Google survey. We're asking everybody to fill it out because we also use that for information for our funders. If it doesn't pop up, and I realize some computers and some companies have restrictions on those pop-ups, so they won't pop up. The survey will also be emailed out to you, the link will, in a follow-up email after today's webinar. You'll have 1 week from today to finish the survey, and then the certificates will be sent out after that date. Between 1 week and 2 weeks, we'll have the certificates sent out to you via email. Please be careful when you enter your email and your name in the survey, because that's what we'll be using to put on your certificate, and the email address will be where we email your certificate. That's the email that you use when you fill out the survey. Melinda, I'm going to turn it over to you and let you get started.
All right, and thank you, Marty. Appreciate you coordinating these Medicare Mondays. We have a great group here this afternoon, and we are going to learn some information about advanced directives and fake imposters, fake government imposters. As we briefly mentioned, April 18th, we will have long-term care Medicaid, and also how do they get my information. And then for May 16th, we will have information on current Medicare schemes. Now that will be possibly a different format, but make sure you sign up and join us. We will have live Q&A after the session this afternoon. I am Melinda Gardner, and I am a benefits counselor with the North Central Texas Area Agency on Aging. And our agency is part of the SHIP, State Health Insurance Assistance Program. And we are trained through the state, and our program here in Texas is called HICAP, Health Information Counseling and Advocacy Program. There are 28 area agencies on aging in Texas, and we're all under HICAP. And then SHIP is the national program, and we provide local services to persons age 60 and over, caregivers, and Medicare beneficiaries of any age. And we help maintain health, obtain public and private benefits, and protect their rights. We are available by phone and email, and we work Monday through Friday. Feel free to check out our website for other services that are provided through the North Central Texas Area Agency on Aging. And so advanced directives, we want to prepare for future healthcare needs. What happens if you have no advanced directives or have made no plans and you become unable to speak for yourself? In such cases, the state where you live will assign someone to make those medical decisions on your behalf. This will probably be your spouse, your parents, if they are available, or your children if they are adults. If you have no family members, the state will choose to represent your best. Some will choose someone to represent your best interests. So we're going to talk about today preparing documents for future healthcare needs, other ways you can express your healthcare wishes, and where to go for help preparing for your future healthcare needs. It is difficult to predict the future with certainty. You may never face a medical situation where you are unable to speak for yourself and make your wishes known, but having an advance directive may give you and those close to you some peace of mind. So there is a federal mandate under the Patient Self-Determination Act of 1991 that does provide some guidance for healthcare workers or healthcare facilities. It requires them to give each incoming patient a statement of rights in regard to making healthcare decisions if someone is on Medicare or Medicaid. It does have a policy in place regarding how they will implement advance directives for each provider. The providers must document in the medical record whether an individual has an advance directive, and the execution of an advance directive by a patient, resident, or enrollee cannot be a condition for them to get care, or the refusal to execute an advance directive cannot be used as a basis to discriminate. So why do we do advance directives? Many people assume that their family members would automatically be able to make decisions about medical treatments if they were to become incapacitated. For example, what if you become unconscious or you're so ill that you're unable to communicate? Well, that's where the advance directives come in. And these rules for advance directives vary from state to state. Each state has different rules regarding who becomes the default decision maker if you do not have a healthcare proxy or some other means of expressing your treatment wishes. If you become unable to make medical decisions because you are incapacitated by a permanent or a temporary injury or illness, anyone from your next of kin to the hospital administrator could be making treatment decisions on your behalf. Would it be in your best interest? That depends. Does a hospital administrator know you? Your next of kin may not even know what your wishes are. So it's important to plan ahead. This will avoid any disagreements around treatment issues if you are incapacitated. We're going to talk about some planning documents that can help ensure decisions made on your behalf meet your needs and preferences. So advance directives is a generic term for a document that you use to appoint an agent and or record your wishes about medical treatment based on your values and preferences. If you have an advance directive, be sure to give those documents to the hospital each time you are admitted. And this is something I've had to do recently. The hospital asked if there was an advance directive, but they never requested a copy of the advance directive. So it's important that you provide that to them so that there's no question about the treatment for your loved one. An advance directive allows you to make your wishes about medical treatment known, But remember, an advance directive is only used if you are in danger of dying and need certain emergency or special measures to keep you alive. But you are not able to make those decisions on your own. Again, advance directives. It is a written document that sets out an individual's preferences about treatment should the person become incompetent or unable to communicate these preferences to medical personnel. Not only are advance directives used to instruct medical personnel when to withdraw or withhold life-sustaining procedures, but they are also used to record a patient's wishes to receive all available medical treatment. So the individual instruction or written statement should be witnessed and govern the withholding or withdrawing of life-prolonged intervention voluntarily executed by an individual. This is not intended as a guide for emergency medical service personnel, because when emergency personnel are called, it's an emergency, so they're going to act in that instance. They're not going to be looking for those documents. So who can do an advance directive? Any competent adult or emancipated minor. And I believe that's anyone over 16. And so what does it take? Well, you must complete a form which is in substantial compliance with the law. Again, it varies from state to state. The document must be witnessed by 2 adults or must be notarized by a notary public. And there are certain witnesses that you can have or witnesses that you cannot have. The person being appointed cannot be a witness. At least one witness may not be related by blood or marriage or adoption or entitled to any portion of the estate. A witness may not be financially responsible for individuals' medical care and cannot be a surrogate or the attending physician. I recently assisted someone in completing advance directives, and they were wanting the same person on everything, and then was going to ask that person also to witness it. And so we had to have that discussion that it had to be someone else witnessing it, 2 people. So when does the advance directive become effective? Only upon determination that the individual lacks capacity and ceases to be effective upon a determination that the individual has recovered capacity. So if there's nothing else stated in the advance directive, it does not become effective until individual lacks capacity. And we've had calls before where someone has created or drafted their advance directives and felt that they had no say in their treatment. But again, unless otherwise specified, it becomes effective when an individual lacks capacity, and it ceases to be effective upon a determination that the individual has recovered capacity. There are also documents called healthcare proxy or medical power of attorney. This document names someone you trust as your proxy or agent to express your wishes and make healthcare decisions for you if you are unable to speak for yourself. It's considered durable because it remains in force if you are incapacitated. There's also a living will, which is called a directive to physicians. And this is a written record of the type of medical care you would want in specific circumstances. It can be used to make treatment decisions if you can no longer communicate your wishes because you are incapacitated by a temporary or a permanent injury or illness. You do want to make sure that your wishes are communicated, and the best way is to have that living will. Advance directives can be revoked. And in order to do that, you should review your advance directive periodically to make sure it still reflects your wishes, because sometimes that does change. You may have a family member who maybe is no longer available to be your agent. So the best way to change your advance directive is to create a new one. The new advance directive will automatically cancel the old one. And it's good to notify all who have copies of your advance directive that you have completed a new one, and make sure that you are destroying the old copies. There's also something called durable power of attorney. Now, this is different than the medical power of attorney. This document typically is prepared by a lawyer, and this document names someone you trust as your agent to make decisions on your behalf related to property, financial, or legal matters. So this is different again from the medical power of attorney. Medical power of attorney is only medical. A durable power of attorney basically is everything else. You choose to appoint the same, you can choose to appoint the same person to be in charge of your medical and financial decisions by naming them your health care proxy and granting them power of attorney, but you still need to complete those two documents. Now, what can someone with a durable power of attorney do? Well, they can be your agent and have the ability to collect your Social Security benefits, use your money to pay your bills, file your taxes, operate your small business if you have one, conduct your banking transactions, manage your investments, buy, sell, and or manage your property, manage your retirement accounts, hire someone to represent you in court, and give gifts or donations on your behalf. So a durable power of attorney can do quite a bit because it does involve property, financial, and legal matters. So it's important that you choose someone that you truly trust. There are other ways you can express your health care wishes. A do not resuscitate order. This tells the medical staff in a hospital or nursing facility that you do not want them to try to return your heart to a normal rhythm if it stops beating or is beating unsustainably using CPR or other life support measures. There's also a do not intubate order, or DNI, and this means that chest compressions and cardiac drugs may be used, but no breathing tube will be placed. So those are some other ways to express healthcare wishes versus a medical power of attorney. Now, the other healthcare wishes, you can use a physician's order for life-sustaining treatment. You can work with a physician, nurse practitioner, or a physician's assistant to fill out this form. And a physician typically fills out and signs this form when you are at the end of your life or critically ill. And you discuss with the physician the specific decisions that might need to be made on your behalf. So if you're not able to discuss those wishes, again, the advance directives are definitely needed. So what does Medicare cover? Medicare covers services to discuss your preferences. And this is possibly a discussion without completing the relevant documents. And if it's done through an annual wellness visit, it's covered at 100%. If it is done outside of the wellness visit, then there could be cost sharing for your Part B covered service. With Medicare and Social Security, they do not accept power of attorney. So there are separate documents and forms that are used to show appointment of representative. And that should be in your handout that you received. You can either click on that link or copy and paste the link in order to get to those forms. So the living will does not need a specific form or a lawyer in most cases. Again, it varies from state to state. Making someone proxy does not require a specific form or lawyer, but the document should follow whatever rules for that particular state. And you want to make sure that your advance directives covers all issues that are important to you. You can discuss these. The power of attorney typically, again, needs a lawyer. And you can discuss these documents with family members, providers, and anyone else that you feel needs to know. It's important to do that because when the time comes and you need these documents, if no one knows what your wishes are, then it will be difficult to follow those wishes. So it's important to discuss the contents of the documents that you prepare. Again, your family members, your providers, anyone else you feel should know. That could be a neighbor who's known you for 50 years. That could be a second or third cousin who you grew up with. So making sure the person that you choose is a trusted person and knows your wishes and will follow your wishes. A copy of the document should be provided to your provider as well as the agent. Some organizations suggest that you compare the generally accepted advance directive form from your state against at least one or two forms from other sources. This is because you may find that one form provides instructions for a particular medical circumstance that another does not. Generally, though, if you find a form that works well for you, you can use that. You may also decide to combine information from several forms into one document. Here are the different help options that you may have at an elder law attorney, and there's a website where you can find an elder law attorney in your area, the State Attorney General's Office, the Department of Health, the National Hospice and Palliative Care Organization, the American Bar Association. Local hospitals are able to help as well. And then your SHIP agencies. Here are some other resources, phone numbers where you can contact if you have questions or if you're looking for additional information. Medicare can help with Medicare covered services. Social Security can help if you have questions about income or starting Medicare. Of course, the SHIP can answer questions about benefits and other government programs. The legal hotline can help individuals. They have attorneys on staff who can help answer questions about legal matters. And of course, the Texas Senior Medicare Patrol, which we will hear from very shortly. Thank you all for joining us. And now we are going to go into fake government imposters. And we're going to hear from Diane Nguyen with the Texas Senior Medicare Patrol. And I will give her access to control the slides. All right, great.
So my name is Diane Nguyen, and I'm the State Program Coordinator for the Texas Senior Medicare Patrol. And the reason it says Better Business Bureau Education Foundation on here is because the Better Business Bureau Education Foundation has the federal grant for the Texas Senior Medicare Patrol here in Houston. talking about fake government imposters, and those are going to be the scammers that pretend to be from a government agency, various ones of them, and they call you and they try to steal your information. And then April is a really great presentation, so I hope everybody joins us back again next month about how do these scammers actually get our information. And in May, we're actually doing the current Medicare schemes. It's a federally funded program, and there's one in every state as well as several territories. And the Senior Medicare Patrol recruits and trains volunteers and professionals about Medicare fraud and abuse. And the purpose is to report intentional fraud and abuse to Medicare fraud control units. We don't actually do the investigations in our office. When you call our hotline, we put together cases, and depending on the case, we send them to different control units, whether that's Medicare, the Office of Inspector General, or the Attorney General. Wherever it needs to go, that's where we send it off. But we don't actually do the investigation, and we don't do determinations if it's fraud. But if we think it could be fraud, we send it off. They handle it from there. The Texas Senior Medicare Patrol is always looking for volunteers that want to help prevent, detect, and report Medicare fraud, waste, and abuse. And there's several types of volunteers. So we need enthusiastic volunteers who want to help assemble bags to be distributed. And these bags have, just informational items about the Texas Senior Medicare Patrol, as well as healthcare journals, which we use, which is used to help keep track of, doctor's visits to compare to your summary notices or Medicare summary notices. And then we also need outgoing volunteers that actually want to give presentations like this one to the community, and also people that really would help us distribute, these bags and also other information to the public. This is because we are the Better Business Bureau. We do encourage consumers to check out businesses on bbb.org. The first two numbers are for the Houston Better Business Bureau, but there are Better Business Bureaus throughout Texas. And then the fourth number, or the third number, 888-341-6187 is the Texas Senior Medicare Patrol hotline. If you ever suspect any fraud and abuse, if you look at your Medicare summary notices or your explanation of benefits, and you see that there's something that doesn't seem quite right, give that number a call. You'll get a live person. So if we don't pick up, it's either not during business hours, or we're already on the phone with someone else, and we'll get back to you right away. You don't have to, it's not going to be, you won't get an automated message. It'll be a real person on the other line. Here we go. Like I said, we're going to be talking about fake government imposters. And these people are scammers that pretend to be the government to steal your money or steal your identity to ultimately steal your money. Today's topics, we're going to be talking about what do they want, why do they want this information, the tricks they pull, the tactics they use, and finally the truth of the whole thing. What do they want? Oh, it is March, so it is kind of leprechaun themed. What do they want? Let's make this simple. So basically what they want is untraceable funds. They want any way to get your money that is not traceable and then you can't get back. So cash, cold hard cash is, the number one thing they want. They also want gift cards. It used to be iTunes gift cards, but they've kind of moved away with that, and now it's Target gift cards. Cryptocurrency. A lot of people are getting scammed with cryptocurrency. There are a lot of cryptocurrency scams out there, but also scammers want people to pay in cryptocurrency because once you send it, you can't get it back. Wire transfer and prepaid debit cards as well. With wire transfers, there's a newer thing. It's money transfer apps, and it's apps that you download on your phone that let you transfer money from one person to the next. And once you send the money, it's gone. You can't really get it back. And so scammers like all of these ways that you might pay them because you really won't get it back. They also want your personal numbers, like your social security number, your bank account, and your Medicare number. Social security scams are the most common form of government imposter scam. So per AARP, Social Security's Office of the Inspector General received more than 718,000 complaints about scams in the 12 months ending September 30th, 2020, a 50% increase from the same period a year before. Reported losses from those cases approached $45 million. The numbers aren't out yet for 2021, but I would only imagine they've gotten worse because people are at home still. We pick up our phones all the time. The scam calls have just gotten worse. Literally today, from this morning, I've gotten about 8 scam calls on my work phone. They want this information. Number is the key to identity theft. Scammers only need your social security number and your birth date, and they can steal your identity. There's a lot of different types of identity theft. Stolen Medicare numbers are one of them. Scammers will do false claims, and they'll take money from the government, which really are our tax dollars, getting supplies like walkers and diabetic equipment you didn't order, and those have been charged to Medicare, and error, fraud, or abuse on your Medicare summary notices. Another example of identity theft are adult children using their elderly parents' benefits, food stamps, prescription drugs, and then Medicare, Medicaid. And also, stolen social security numbers is a big one. People can use this to file for unemployment, take out loans, credit, file taxes. It can really ruin your credit, and your credit report, all of those stuff if somebody steals your social security numbers. Account numbers, because your bank account is your money. If somebody has a hold of your bank account numbers, they could just drain that money from, your bank account. Consider using a credit card for purchases rather than debit cards. Credit cards have added protection versus a debit card. If you're ever going to make purchases online or even in restaurants, consider using a credit card because they're not linked directly to your bank account like a debit card is. So you should always treat a debit card like cash. If you're swiping it, you're spending your money right then and there. But credit cards are different because it's kind of, it's not directly linked to your bank account. You pay at the end of the month. And there's added fraud protection on credit cards. You can actually dispute fraudulent charges. Say you saw an ad online for a leather jacket and it was on sale and you bought it with a credit card and the leather jacket comes in, but it's not really leather, it's fake, it's really bad quality, it's not what they advertised. Well, if you, kept your receipt and you kept a copy of the advertisement, you can actually dispute those charges with the credit card company and you may get your money back. So if you do purchases online, it's probably better to use a credit card. And there was somebody that worked here that went to eat at a restaurant and he used his debit card and then he forgot his debit card there and he came back here and then he's like, oh, I forgot my debit card. He went to get his debit card, but he checked his bank account and they already pulled like $1,200 from his debit account because he used his debit card and they really could charge any amount on there. So be really careful. And like I said, I recommend using a credit card to make purchases rather than a debit card. Scammers also target Medicare. A Medicare number is worth $30,000, but unfortunately not to any of us, only to a scammer. And that's $30,000 a year, I believe. So a caller will claim to be from Medicare, or someone's calling about Medicare, or they just want to visit you at home. Just hang up. Medicare will never, ever call you by the phone or come to your house. So if this ever happens, it's not Medicare. It's just a scammer. Anybody claiming to be Medicare, asking you to verify your Medicare number, it's not them. And something we've seen in the office recently, it's been, we've been getting these calls more frequently, are people calling and saying, you are getting a new Medicare card. It's going to be plastic this time. There's no new Medicare card. in plastic or, you know, in any different colors right now. If anybody calls asking for your Medicare number, it's not Medicare, it's a scammer. Also, Medicare already has your Medicare number. They don't need you to tell them. Why is Medicare an easy target? So Medicare processes 5.4 million claims per working day to 1.5 million different vendors and providers. This means they have a very large volume of claims to go through, you know, a day. And they have to pay that within 30 days. Prompt payment system, CMS must pay claims within 30 days. So as soon as they get one, they only have 30 days to pay it. And there's no documentation that's required unless it's investigated. And only 3% of claims are reviewed. So if you ever see anything that's suspicious, you should definitely contact Medicare and tell them to look at, you know, the claim, or call us and we'll help you with it as well, if it could be fraud. Because a lot of things just slip through the cracks because they have to go through so many claims and have to pay back, you know, pretty fast considering the amount of claims they have a day. So be sure to check your Medicare summary notices and your explanation of benefits and make sure everything is right every time you get them in the mail, because, you know, there's so many things that Medicare just won't catch. So the tricks. So you may receive a phone call, email, or text message from a scammer who pretends to be an agent from the Social Security Administration. They might be a Social Security employee, law enforcement, the government. Or maybe it's not a person, it's a robocall. So these are pre-recorded messages through auto dialing technology. And what auto dialing, they have auto dialing machines that basically dial as many numbers, and then as soon as somebody picks up, it connects that person to a live person. So these scammers don't even have to work that hard to find somebody to pick up the phone because the computer does all the work. And I actually checked the other day, and there's an app. You can buy an app on the phone that is an auto dialer. It's so easy to access this kind of technology, and it's really cheap. So the scammers don't have to do a lot of work finding people. They just have the computers do it. And then as soon as someone picks up, it connects them to a live person. And I don't know if anybody else has noticed, but I get a lot of scam calls on my office phone, and I pick it up because it's my office phone. I don't know if it's a real person or a scammer, but I always hear a beep in the beginning of a scam call, and it's the same beep. And I think it's the auto dialer connecting me to a live agent. Lots of different calls from that could be from robocalls, scams that could be from robocalls, health insurance for COVID, supplies for COVID, the census. It's especially bad when the census is actually happening. Sweepstakes, Medicare, Medicare plans, medical supply, IRS, Social Security, car warranty, surveys, or computer updates. The best way to go is if you don't know the phone number, I just wouldn't pick it up. And if you answer, it's not rude to hang up either. Definitely hang up, because if it's somebody trying to keep you on the phone, it's probably a scam. This is a quick video. Oh. About the IRS scam.
Okay, try it again.
Scam artists are pretending.
Try it again, sorry.
Scam artists are pretending to be IRS officials to get your money. They'll call, email, or text you, claiming you owe back taxes or there's a problem with your tax return. They even rig caller ID to make the call look official. They play on your fears. They threaten to take your driver's license or sue, arrest, or deport you. They want you to pay fast. What's the truth? The truth is the IRS's first contact with you will always be a letter in the mail. It's not a phone call, email, or text message. They won't insist that you pay with a prepaid debit card, a wire transfer, or cashier's check. Now you know. Has an IRS imposter contacted you? Report it at ftc.gov/imposters.
And there were over 50 billion robocalls made. And that is a lot of robocalls. Obviously, a real person doesn't need to be on the phone, so they're really easy to do. They just spam out calls to as many numbers as they can. And also they'll have like, the numbers will typically, or actually I'll get into it when we talk about spoofing. A common one is there's a problem with your social security number. And spoofing, this is what I was about to talk about. Scammers can make the caller ID on your phone look like anything they want to. It'll have the same area code. It'll look really familiar. And this is, I don't think this is legal, but you know, it's really hard to regulate this kind of thing. So we're more likely to pick up numbers that are familiar to us. So if, you know, my work phone is 713. So, you know, if I see a 713 number, I think it's, you know, someone in Houston calling me, but it's usually just a scammer. More likely to pick up numbers that, you know, might be more relevant to us. There's also phishing, which is kind of similar to spoofing. Just like with regular phishing, when phishing, the criminals are baiting a hook to catch you. Phishing is a technique of sending an email intending to trick you into clicking on a malicious link or downloading an attachment potentially laced with malware. So you might get an email that's generic. It might be from someone you know, or, you know, or a random contact, and I'll have a link or a link to something that when you type in your information, it's actually stealing your information, or it has some kind of attachment that when you download, it puts a virus on your computer. And it might, there's a lot of ways that scammers can actually hack into people's emails, and then they send mass emails to everybody in that person's contacts list, or they, or it could be an email that looks like it's from, you know, a well-known company like Amazon or Facebook. If you ever get emails from Amazon or Facebook, I know some people have like email alerts from them. I wouldn't ever click on any links. I would just type in the web address manually. And if you ever get an email, you know, from the IRS or something threatening you, it's not from the IRS, because they won't threaten you over email. What to do about these calls and emails. Don't pick up any phone calls from numbers you don't know. Ignore any calls from unfamiliar numbers. Don't click or download any suspicious links or attachments. If it is an email from someone that you do know and it looks kind of fishy, I would call that person and ask them, did you send me this email, instead of just opening it and then just delete it. Government organizations, they're not going to call you or email you with, you know, and threaten you. They'll probably send a letter in the mail before, if anything. 3 primary ways to steal information: malicious web links, which I talked a little bit about earlier. So they'll put links that might look legitimate, and they might even take you to a web page that looks legitimate. Like they might have something that looks exactly like the Social Security website, but it's not. It's actually a fake website. Or attachments in emails that'll put viruses in your computer, or fraudulent data entry forms that could also be a link as well that's sent to your email. What are some of the tactics that they use? Threat. They'll threaten you. So they'll say you're going to get arrested, you're going to go to jail, you have to pay legal fees and go to court, unable to get your benefits. They'll cancel your benefits, cancel your Social Security check, revoke or freeze your Social Security. They will say anything to scare you into giving them money right then and there. With Medicare, they'll threaten you that they'll suspend your Medicare benefits unless you need to verify this information, but then you're really just giving them your Medicare number. Or they might even offer a solution to increase your benefits, protect your assets, or resolve the matter of identity theft. And I said earlier, and just reiterating, Medicare will not call you. So if you get a call or someone goes to your door, or an email or a text message or something on Facebook even, they're not going to contact you in any of these ways, especially with social media. Government agencies are definitely not going to contact you through Facebook. So the truth. Inspector General has provided reassurance that Social Security will never, 1, demand immediate payment of a fine or fee as a way to avoid legal action or jail time, require untraceable forms of payment, solicit payments or money in exchange for an increase in benefits or other assistance, and send anything with personally identifiable information via email. Your Social Security will never be suspended, revoked, frozen, or blocked. And don't wire or send, wire money or send gift cards to anyone you don't know. And if you get a phone call from someone claiming to be Social Security, hang up and then don't just call them back. Go call the Social Security Administration's main number, which is 1-800-772-1213. And you can also just look up their number online as well. Don't just redial a number because it could be, you don't really know who you're calling if you just redial them. With Medicare will not call you, as I said, like a bunch of times. Never provide personal information or your Medicare number to anyone calling you out of the blue. The only people you should be giving your Medicare numbers to are your healthcare providers. And, if you're seeking out a service, like if you call the Area Agency on Aging yourself because you need help with something, but never give it to anyone that's calling you out of nowhere. Keep an eye on your Medicare summary notices and explanation of benefits to catch error, abuse, and fraud. And if you do look at them and then you see something suspicious, call us at the Texas Senior Medicare Patrol. The number is 888-341-6187. That's 888-341-6187. And like I said, you'll get a live person. You won't get, a menu where you have to select anything unless we're not in the office or on the phone already with someone else. And just an example in the news, mother-to-be lost $5,000 to government imposter scam, and the caller claimed to have a warrant out for her arrest. And in the moment, it probably seems really scary because, when you just get a call out of the blue and they're threatening you, scammers are really good at this. They do this all day. So there's no shame in, if something like this does happen. But the best way to not get scammed is to know about the scam. So just by being here, you're ready. Your odds are better than people that don't know. So just be careful and spread the word about, these kinds of scams. And here's some bonus scams. So I mentioned earlier the money transfer apps. So what a money transfer app is an app on your phone that helps you easily transfer money to other people quickly. It's connected to your bank account, credit card, or debit card. And once you send the money, it's gone. You cannot get it back. So there's a few scams that go along with this. One is not really a scam, but it's how scammers like to receive money. But the actual scams associated with the apps are fake accounts that look like other legitimate accounts, kind of like, the spoofed phone numbers. Another one is, oops, I accidentally sent you money. If anybody sends you money through one of these apps, and you don't know them, don't send it back when they ask for it. Just contact the app if you use it and tell them what happened, because it's like getting a check and it bounces. So if somebody sends you money and you send it back and the funds weren't actually legitimate in their account, they're going to just pull it from your bank account. And then be wary of businesses that only accept this form of payment, because legitimate businesses shouldn't this kind of payment. Some safety tips. So you can link these accounts to a credit card, but there are going to be fees that apply. It's like 3% usually. Be wary of businesses that only accept this form of payment. And if you're going to be sending money, make sure to verify the recipients before sending it to make sure you have the right person. Never send or accept payments from someone you don't know. Have strong passwords, and this is for your bank account, your Social Security account online, any kind of account online. Have passwords that other people won't be able to guess, but you can remember. So I wouldn't choose birthdays or things that other people might know. And keep transactions private. Check your bank accounts after you transfer the money to make sure it went through. Because it's an election year, be careful of, election scams. Some voter surveys might not be legitimate. Be careful of things that claim you can register to vote a certain way. They might not be legitimate. You don't want to accidentally give away personal information to someone, and political donations. Some tactics that they might use are fake prizes, but you have to pay the taxes. Vote by phone, email, or text, you can't do that. And they need your support for a cause, but they're really just stealing your money. So some recommendations are, don't give away personal information or money to anyone that's just calling you randomly. If you want to, give money to a candidate, do it through their website directly. I wouldn't just do it to somebody that's calling me or texting me. Just do it directly to the candidate's official website or local campaign office, because you don't know, scammers are taking advantage of political. And if you run into a scam, report it. Report it to the Office of Inspector General. You can also do it, I think BBB has one. And also if you run into if you see anything on your Medicare summary notices or explanation of benefits that seems suspicious, call the Texas Senior Medicare Patrol. And here is the hotline number again, 888-341-6187. And this is the Texas Senior Medicare Patrol team in Houston. Jennifer Salazar is the program director. That's me. As the second one, you feel free to email or call me if anybody has any questions. And then the third person, Lily Chu, is our volunteer coordinator. And that's the end of my presentation.
Very, very good. I'll add a couple of side notes to that, just because I have some very recent experience. My mother, who's 83, was just scammed about a week and a half ago out of several $1,000s. You just have to be so careful. You can't, hanging up on these people, they're crooks. They might sound nice, they're crooks. You just got to hang up the phone on them, because they're very manipulative. They'll entrap you and make you feel like something terrible is going to happen if you don't do what they tell you, and if you hang up the phone or you tell anybody, it's going to make it worse. It's going to make it worse, because they've got to keep you on the phone, and that's the only way they're going to be able to scam you, is if they can keep you on the phone and keep you from telling somebody that's going to tell you, get off the phone. So make sure you do that. The other thing too is, I got one several years back. I got a text that said it was from my priest, and it was on the front. It was basically his name on the text, that he needed some gift cards for a parishioner that was in the hospital, and I just kept asking questions, and it became very clear to me it was a scam. And I've had it. I bet I've had that same scam 10 times since then, and most recently. It came from Donnie Green, who's the person I worked for at the North Central Texas Area Agency on Aging, because they just go online and see our names working under her, and so they send you a text saying it's Donnie, and I need your help with these gift cards. And if they ever ask for gift cards, it's just red flag, red flag, red flag. But again, be strong enough just to hang up. Don't feel like you have to. Don't feel like you're going to be rude or these are crooks, and they're just because they're nice to you doesn't mean they're still not crooks.
Right. Exactly.
It's so hard for the generation is so used to having to be courtesy, have courtesy, common courtesy, being nice to people, and these people absolutely take advantage of that. So you just got to be able to hang up the phone and then get somebody that can help you. And if you need to call somebody back, you call the number, like she said, you look it up on the internet, you go to your bank and talk to the person at the bank. Don't recall a number that anybody's called you from or that they've left for you to call on your answering machine or anything like that. It is just, I'm telling you, they're getting so many people these days, it's crazy. And the only way we can stop it is by just continuing to get the word out that these people are out there, and even with charity stuff, they try to scam you for money.
Right.
They're trying any
Any
direction,
and everything.
any place that they think they can get a dollar, they're going to try. Great
Yes.
job.
And one of the presentations from, I think it was last week, due to the National Consumer Protection Week, they were saying that most of the people that are scammed are under 65, but the amount of money that is people are scammed of is more so over 65. So they're providing more money to the scammers, but most of the people are under 65. So it can happen to anyone. And it's important for those of you that are on today is to share it with one other person. And hopefully that one other person will share it with someone else so that we can get the word out there. We can never have enough people sharing that information. And there was a mention of I think Diane talked about it, is, if somebody's sending you money and then they call you and say that, oh, I sent it in error and they want you to send it back. Well, it's coming out of your account because what they sent is really not true. So Diane, did you talk about that?
So there is a scam that they will send you some amount of money and they will tell you, oh, I accidentally sent it. Can you please send it back? And good people, we would think, okay, that was an accident, so let me send it back. Well, the way it's like a check almost. So it takes a little bit for it to process. But then once the app realizes that the funds weren't legitimate in the first place, it's going to take the actual money out of your own account and then pass it to the other person. And by that time, you
it's
can't
gone.
Really get it.
Right.
Yeah. So
And I'm not sure how it works.
Thank you for that example.
Yeah, there was also a scam going around where they would send out what looked like cashier's checks to you. And if you deposited that into your account, I'm not sure how they did it, but they were able to turn around and suck the money out of your account if you just even tried to deposit that into your account. And that went around for a while because I know our bank up here in Pilot Point had several problems with that. And so even if you receive what looks like a legitimate check from someone who you don't know, don't just go deposit that into your account. Somehow they're able to get that information when you do that. And I know it's foreigners trying to do it, but they're not able to track it. I don't know why, but they're not able to track it. So any
wants some packets, Diane?
If you want any
Peggy?
information, can you email me and then
there's feedback, so I can't tell what you're saying. I don't know if that's on my end.
I'm hearing a little bit of it, but I'll send out Diane's email address with the and her contact information and you've got it on here right now. But if you could email her and she could send you you can send them packets, right? Is that right?
I will definitely mail them out if you would send me an email, and then I can mail them out from here.
Yeah, that's great. That's perfect. Yes, Peggy. I'll send that, or you've got it on the screen, or I'll send it to you I'll include it in the follow-up as well. And just so you know,
let her know how many packets are needed.
Yes. And then also, I know Peggy has a senior group that meets at CCA. I don't know if you've done any presentations there at all, but I know they have. Peggy, do they still meet weekly? They used to meet weekly, and I don't know if it was weekly or monthly. They have they used to meet and have lunch and then do their pantry shopping, but I don't know if they still do that.
In which county?
This is Denton County.
Okay.
CCA
in Louisville?
Action in Louisville.
Oh, okay.
Yeah.
Yeah.
So
we would love to present to them.
Yeah. Then the other thing is, if you guys have any questions, you can put it in the chat real quick. If you have any, if you didn't get the link to the slides, I put it in the chat. But I'll also include that in the email as I follow up. They're meeting right now weekly. Oh, we're not meeting weekly because of COVID. We'll open soon. Okay,
Yes.
that's great. Peggy,
You can definitely reach out to me.
yeah, that's super. That's very,
And Pierre, thank you for sharing your experience. But yes, that sounds like it is a scam that is probably will continue because we're using those apps so much.
yeah. Okay, well, thank you all so very much. I'm going to go back over the CEUs here real quick. Again, we're providing CEUs for licensed professional counselors and social workers in the state of Texas. If you're one of these outside the state of Texas, please, you're more than welcome to go through the process, get a certificate. You can submit it to them. There's just no guarantee whether they're going to take it or not, and we don't have any control over that. Also, a certificate of attendance, if you're looking for that, that would go through the same process as the CEUs. The certificates will be different, but you'll go through the same process. It's for 1.5 hours of class time. You needed to be on for the entire webinar. There's 2 different sources of information we'll need. Number one, the Zoom report that we'll get that will show that you were on and how many minutes you were on. Then we'll also need you to complete the survey. The survey should pop up as you close out today. If it doesn't, you'll also receive the link to the survey in the email I'll send out afterwards, which again, I'll include the phone numbers for as well, and the link to the slides. You'll have 1 week to do the survey, and then give us the following week to get the surveys to you. And then next month, as we mentioned right at the very beginning, we're going to be doing long-term care Medicaid and how do scammers get your information. Great. I mean, that's going to be really good. That's going to be very, very good. So thank you, Diane. Thank you, Melinda. Thank you so much. Great stuff. Thank you all for joining us. In a couple of days, I'll send out the second follow-up email that will have the link to the recording. Please help us spread this far and wide so we can get the information out to as many people as possible and hopefully cost the scammers some money and save your people some money. Thanks, y'all. Have a great day.